Are you struggling with an underactive thyroid and seeking effective treatment? Look no further than liothyronine sodium. This video explores the common uses of liothyronine sodium in thyroid hormone replacement therapy, shedding light on how this medication can help restore thyroid function and bring relief to those suffering from hypothyroidism. Liothyronine sodium, also known as T3, is a synthetic form of the thyroid hormone triiodothyronine. It works by increasing the levels of thyroid hormones in the body, supplementing the insufficient production by the thyroid gland. This medication is often prescribed when levothyroxine alone is not providing optimal results. Thyroid hormone replacement therapy is crucial for individuals with hypothyroidism, as an underactive thyroid can lead to a variety of symptoms, including fatigue, weight gain, depression, and cold intolerance. Liothyronine sodium plays a vital role in restoring hormonal balance and alleviating these symptoms, enabling patients to reclaim their energy and well-being. Understanding thyroid hormone replacement therapy. Thyroid hormone replacement therapy is a treatment approach designed to address the underlying hormonal imbalance caused by an underactive thyroid gland. The thyroid gland, located in the front of the neck, produces hormones that regulate the body's metabolism, energy levels, and other essential functions. When the thyroid gland fails to produce enough thyroid hormones, a condition known as hypothyroidism occurs. Hypothyroidism can have a significant impact on a person's quality of life, leading to symptoms such as fatigue, weight gain, dry skin, hair loss, and mood disturbances. Without proper treatment, these symptoms can worsen over time and significantly affect daily functioning. Thyroid hormone replacement therapy aims to provide the body with the necessary thyroid hormones to restore normal function and alleviate the associated symptoms. Role of liothyronine sodium in thyroid hormone replacement therapy. Liothyronine sodium, a synthetic form of triiodothyronine, T3, plays a crucial role in thyroid hormone replacement therapy. Unlike levothyroxine, which is a synthetic form of thyroxine, T4, liothyronine sodium directly provides the active form of thyroid hormone that the body needs. While levothyroxine is the most commonly prescribed thyroid hormone replacement medication, liothyronine sodium is often used in combination with levothyroxine or as an alternative when levothyroxine alone does not adequately address the symptoms of hypothyroidism. Liothyronine sodium is particularly beneficial for individuals who do not convert levothyroxine into sufficient amounts of T3, the active form of thyroid hormone. This can happen due to various factors, including genetic variations or certain medical conditions. By directly supplementing T3 levels, liothyronine sodium helps restore the hormonal balance in the body and provides relief from the symptoms of hypothyroidism. Common uses of liothyronine sodium. Liothyronine sodium is primarily used in thyroid hormone replacement therapy for individuals with hypothyroidism. It can be prescribed in several scenarios, including inadequate response to levothyroxine. Some individuals may not experience optimal symptom relief with levothyroxine alone. In such cases, adding liothyronine sodium to the treatment regimen can help improve symptoms and overall well-being. Thyroid hormone resistance. Certain individuals have a condition called thyroid hormone resistance, where their body's tissues do not respond adequately to thyroid hormones. Liothyronine sodium can be used as an alternative or in combination with levothyroxine to provide the necessary T3 levels for symptom management. Temporary support during thyroid hormone withdrawal. In situations where thyroid hormone replacement therapy needs to be temporarily discontinued, such as in preparation for radioactive iodine therapy, liothyronine sodium can be used to provide thyroid hormone support during the withdrawal phase. Dosage and administration of liothyronine sodium. The dosage of liothyronine sodium varies depending on the individual's specific needs and response to treatment. It is important to follow the prescribed dosage and consult with a healthcare professional for any adjustments or concerns. Liothyronine sodium is typically taken orally in tablet form. It is usually recommended to take the medication once a day in the morning on an empty stomach, at least 30 minutes before breakfast. This helps ensure optimal absorption and effectiveness of the medication. It is crucial to adhere to the prescribed dosage and not make any changes without consulting a healthcare professional. Regular monitoring of thyroid hormone levels through blood tests is also necessary to assess the effectiveness of the treatment and make any necessary adjustments. Potential side effects and precautions. As with any medication, liothyronine sodium can have potential side effects and precautions that should be considered. Common side effects may include heart palpitations, increased heart rate, nervousness, and sweating. These side effects are usually temporary and subside as the body adjusts to the medication. However, if they persist or worsen, it is important to seek medical advice. Liothyronine sodium should be used with caution in individuals with certain medical conditions, such as cardiovascular disease, adrenal insufficiency, or uncontrolled hyperthyroidism. It is essential to disclose any pre-existing medical conditions and medications to the healthcare professional before starting liothyronine sodium to ensure safe and effective use. Comparing liothyronine sodium with other thyroid hormone replacement medications. Liothyronine sodium is just one of the options available for thyroid hormone replacement therapy. The most commonly prescribed medication is levothyroxine, a synthetic form of thyroxine, T4. Levothyroxine is often the first-line treatment for hypothyroidism and is effective for the majority of individuals. However, some individuals may not convert levothyroxine into sufficient amounts of T3, leading to persistent symptoms. In these cases, liothyronine sodium can be considered as an alternative or in combination with levothyroxine. While levothyroxine provides T4, which the body then converts into T3, liothyronine sodium directly provides T3, bypassing the conversion process. This can provide more immediate relief for individuals who have difficulty converting T4 to T3. The choice between liothyronine sodium and levothyroxine, or a combination of both, depends on individual circumstances, symptom severity, and response to treatment. It is essential to discuss the options with a healthcare professional to determine the most suitable course of action. Frequently asked questions about liothyronine sodium. Is liothyronine sodium the same as levothyroxine? Liothyronine sodium and levothyroxine are both thyroid hormone replacement medications, but they contain different forms of thyroid hormones. Liothyronine sodium provides the active form of thyroid hormone, T3, while levothyroxine provides T4, which the body then converts into T3. Can liothyronine sodium be used as a standalone treatment for hypothyroidism? Liothyronine sodium is typically used in combination with levothyroxine or as an alternative when levothyroxine alone does not provide adequate symptom relief. It is not typically prescribed as a standalone treatment. What should I do if I experience side effects while taking liothyronine sodium? If you experience side effects while taking liothyronine sodium, it is important to consult with a healthcare professional. They can assess your symptoms, determine if any adjustments need to be made to your dosage or treatment plan, and provide guidance on managing any side effects. Consultation with a healthcare professional before starting liothyronine sodium. Before starting liothyronine sodium or any thyroid hormone replacement medication, it is crucial to consult with a healthcare professional. They can assess your specific situation, conduct appropriate tests, and provide personalized recommendations for treatment. Thyroid hormone replacement therapy requires careful monitoring and adjustments to achieve optimal results, and a healthcare professional can guide you through the process. It is important to discuss any pre-existing medical conditions, medications, and concerns with the healthcare professional to ensure safe and effective use of liothyronine sodium. Conclusion. Benefits and considerations of liothyronine sodium in thyroid hormone replacement therapy. Liothyronine sodium, also known as T3, plays a significant role in thyroid hormone replacement therapy for individuals with hypothyroidism. It provides the active form of thyroid hormone that the body needs, supplementing the insufficient production by the thyroid gland. By restoring hormonal balance, liothyronine sodium can alleviate the symptoms of hypothyroidism and improve overall well-being. While levothyroxine is the most commonly prescribed thyroid hormone replacement medication, liothyronine sodium is often used in combination with levothyroxine or as an alternative when levothyroxine alone does not adequately address the symptoms. It can be particularly beneficial for individuals who have difficulty converting T4 to T3. As with any medication, it is essential to consult with a healthcare professional before starting liothyronine sodium. They can provide personalized guidance, monitor your progress, and make any necessary adjustments to ensure safe and effective treatment. If you are struggling with an underactive thyroid and seeking relief from the associated symptoms, liothyronine sodium may be a valuable option to explore. Discuss your concerns and treatment options with a healthcare professional to determine the best course of action for your specific needs.